Have you ever wondered what's really happening every time your heart beats? Well, every time it beats, it pushes blood through your arteries, the blood vessels that carry blood from your heart to the rest of your body. As that blood flows through, it creates pressure against the walls of those arteries. And that pressure? That's what we call blood pressure. When you check your blood pressure, it's just measuring that force while your heart is pumping, and the result shows up as two numbers. In this video, we'll break it down in a simple way and explain why those numbers matter. Blood pressure is measured as two numbers. The first number is called systolic pressure. This is the top number, and it measures the pressure inside your arteries when your heart beats and pushes blood out. The second number is called diastolic pressure. This is the bottom number, and it measures the pressure in your arteries when your heart is resting between beats. For example, if your blood pressure reading is 120/80, that means your systolic pressure is 120 and your diastolic pressure is 80. Let's take a closer look at each number. First, systolic blood pressure. This is the top number. It's the highest level of pressure in your arteries when your heart beats and pushes blood out to your body. In simple terms, it shows how hard your heart is working to pump blood through your system. If your systolic number is too high, it could mean your heart is working harder than it should. Over time, that can be a sign of high blood pressure, also known as hypertension. Now let's talk about diastolic blood pressure, which is the bottom number. This is the lowest level of pressure in your arteries when your heart relaxes between beats. It tells us how much resistance there is in your blood vessels while the heart is resting. If the diastolic number is high, it may mean the blood vessels are narrow or stiff, and that can increase the risk of heart disease, stroke, and other serious health problems. So what's considered normal? For most adults, a normal blood pressure reading is around 120/80. But keep in mind, that number isn't the same for everyone. What's considered healthy can vary depending on your age, your overall health, and other individual factors. That's why it's always best to talk to a healthcare professional to understand what's normal for you. It's also important to check your blood pressure regularly, and simple lifestyle habits can make a big difference. Things like eating a balanced diet, staying physically active, managing stress, and getting enough sleep. From a medical point of view, understanding the difference between systolic and diastolic pressure really matters. Each number gives us different information about how the heart and blood vessels are functioning. And when you look at them together, they give us a clearer picture of your overall cardiovascular health. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.